Talk a little bit about what are some of the biggest challenges that you and the organization are focused on right now?
Well, certainly, leaders in post-acute care organizations are, not immune from the things that are affecting their operations. Leadership is critical to assuring that the outcomes that you have within the operation are desirable and positive. Certainly, probably right up there at the very top is maybe 1 and 1A are regulatory burden and staffing. And that, depending on the day, depending on the geographic area, that could be, you could reverse those. The challenges associated with finding and keeping good quality people. A lot of people focus on the front line, and certainly that is where it starts. But the openings, the vacancies that exist out there are not just frontline. Our population as a whole is aging. And so it is a challenge to find individuals to come into not just, frontline caregiver roles, but certainly nurses, nursing leadership, and certainly included in that would be, the administrator or the executive director. That is a challenge. We're involved in those discussions, and we believe that we have some, things that we offer that are certainly contribute positively to being able to enhance that entry into the profession for the post-acute leader. Along with that, of course, is regulatory burden. Our profession is such that a high proportion of our payment is dependent largely on the government. Whether it's Medicare or Medicaid programs, 80 to 85% in many cases of our revenue is basically dependent directly on what the government is willing to pay. And so, combine that with the regulations that the government puts out, both at the national and the state level. And there are, more than our fair share of unfunded mandates out there that create a conundrum of challenge for skilled nursing providers. And so, those are the main challenges that we're dealing with out there. Certainly, again, other things such as, the innovations that are going out in terms of various payment systems, the ongoing evolution of the patient-directed payment model, PDPM, and, value-based purchasing types of programs. There is no shortage of things to do when you're an administrator in a skilled nursing or assisted living facility.